Okay, have you ever just felt like really cold, even when everyone else seems perfectly comfortable?
Hmm.
Or maybe you've noticed your weight fluctuating, going up or down, seemingly without any rhyme or reason.
Yeah.
And what about that brain fog? You know, that feeling where you just can't seem to focus or think clearly? It's like your brain's stuck in a haze.
Oh, absolutely. I've definitely
Okay.
experienced that.
Well, these seemingly random, unconnected symptoms could actually be subtle signals from a tiny but incredibly powerful gland in your neck.
You're talking about the thyroid, right?
Exactly, the thyroid. It's this small, butterfly-shaped gland that sits right here in your neck, and it plays a huge role in regulating so many bodily functions.
It's amazing how such a small gland can have such a big impact on our overall health and well-being.
Absolutely. And in this deep dive, we're going to unravel the mysteries of the thyroid, explore how it works, what can go wrong, and how those malfunctions manifest in a variety of ways.
It's a fascinating topic, and I'm sure our listeners will be intrigued to learn more.
I agree. Before we get started, a huge thank you to the London Heartbeats Z Academy UK for their educational support of this deep dive.
Yes, their support is invaluable.
For our listeners who want to learn more about what they do, they offer over 150 popular courses on a wide range of topics.
Definitely worth checking out.
Absolutely. And don't miss out on our future deep dives into all sorts of fascinating subjects. Subscribe to our social media channels on Facebook, Instagram, and YouTube for free, regular updates.
You won't want to miss them.
So let's jump right in. What exactly is this thyroid we're talking about?
Well, picture a small gland, kind of like a shield or maybe a bow tie, nestled right there in your neck, just below your Adam's apple. It might be small, but its influence is far-reaching.
It's amazing to think that something so small can have such a big impact.
It really is. You know, the first person to really identify and describe the thyroid was a physician named Thomas Wharton way back in the 17th century.
Wow, so it's been known about for quite a while.
Oh, definitely. And over the centuries, our understanding of the thyroid has grown tremendously. In fact, the importance of this gland is so recognized that Theodor Kocher, a Swiss surgeon, was awarded the Nobel Prize in 1909 for his pioneering work on the thyroid, including its function, the diseases that can affect it, and how surgery can be used to treat those conditions.
A Nobel Prize. That's incredible. It really highlights the vital role the thyroid plays in our overall health.
Absolutely.
So we've established that the thyroid is this small but mighty gland in our necks. What's its main function? What does it actually do?
It's all about hormones. The thyroid gland is like a tiny hormone factory, producing and releasing crucial chemical messengers that travel throughout the body, influencing a vast array of functions.
Okay, so hormones. What kind of hormones are we talking about, and what do they do?
The thyroid primarily produces two key hormones, thyroxine, also known as T4, and triiodothyronine, known as T3. These hormones act like tiny regulators, controlling things like metabolism, growth, and development.
I see. So they're kind of like the body's internal thermostat and growth regulators.
Well, that's a great analogy. They affect how quickly our bodies use energy, how efficiently we burn calories, and they play a vital role in the development of our brains and nervous systems, especially during infancy and childhood.
That's amazing. So how does the thyroid actually make these essential hormones? What's the process involved?
Well, it's a bit like a complex recipe with several important steps, but to really appreciate how it all works, we first need to understand the thyroid's unique structure.
Okay, let's zoom in and take a closer look at the microscopic world of the thyroid gland. What's it made up of?
Picture a microscopic landscape filled with numerous tiny spherical sacs called follicles. Think of these follicles as microscopic factories.
Like little hormone production units.
Precisely. Each follicle is filled with a gel-like substance called colloid, which serves as the storage site for thyroid hormones.
So it's like a warehouse within the factory.
Exactly. Surrounding each follicle are follicular cells, which are responsible for actually producing the thyroid hormones.
I see. So those are the workers in the factory.
Exactly. Then, scattered between these follicles are another type of cell called parafollicular cells, or C cells, which produce a different hormone called calcitonin. We won't delve too deeply into calcitonin today, but it's important to know that it plays a role in calcium regulation.
Okay, so we have follicles filled with colloid, follicular cells producing hormones, and C cells handling calcium. Anything else we should know about this microscopic thyroid landscape?
Yes. One more crucial component. Within the colloid, you'll find a large protein called thyroglobulin. This protein plays a vital role in the hormone production process. Think of it as a scaffolding onto which the building blocks of thyroid hormones are assembled.
So the thyroglobulin is like the framework on which the hormones are constructed.
Precisely.
This is all fascinating, but how do these different components actually work together to produce those essential T3 and T4 hormones?
Well, the thyroid hormone synthesis process is truly remarkable, a multi-step operation that involves several key players.
Okay, let's break it down step by step.
The first step is the uptake of iodide. Iodide is a form of iodine that we get from our diet. It circulates in our bloodstream and needs to be actively transported into the thyroid cells to be used for hormone production.
So it's like the raw material being delivered to the factory.
Exactly. And this uptake process is very specific. It's driven by a protein called the sodiumiodide symporter, which sits on the membrane of thyroid cells and acts like a pump, pulling iodide ions into the cell.
So it's not a simple diffusion process. It requires energy to bring iodide into the cell.
Precisely. And this symporter is quite fascinating. It uses the movement of sodium ions into the cell to power the transport of iodide ions. It's like a 2-for-1 deal, where sodium acts as the key to unlock the door for iodide to enter.
That's really clever, but I imagine there could be things that interfere with this transport process.
You're absolutely right. Certain substances like thiocyanate, perchlorate, and pertechnetate can actually compete with iodide for binding to the symporter.
So they're like imposters trying to block the real key from entering the lock.
Exactly. And this competition can reduce the amount of iodide that gets into the thyroid cells, potentially affecting hormone production.
Wow, that's amazing. And are there other substances that can mess with iodide transport?
Yes, there are. Even things like bromide, fluoride, and lithium, which you might encounter in various forms, have been shown to inhibit iodide transport. This really highlights how interconnected our bodies are and how even seemingly unrelated substances can have an impact on thyroid function.
It's a reminder that everything we put into our bodies, even things we might not think about, can have consequences.
Absolutely.
Okay, so we've got the iodide inside the thyroid cells. What's the next step in this hormone production journey?
Once iodide is inside the thyroid cell, it undergoes a transformation known as oxidation. This is a chemical reaction where the iodide loses an electron, making it more reactive. This crucial step is facilitated by a key enzyme called thyroid peroxidase.
Thyroid peroxidase. It sounds like a powerful worker in the thyroid factory.
It is. This enzyme is essential for the next phase, iodination.
Iodination. So we're adding iodine to something.
Precisely. The oxidized iodide, which is now more reactive, attaches itself to specific sites on the thyroglobulin protein we discussed earlier. Remember that large protein serves as the backbone for hormone construction.
Right, like scaffolding. So
Yeah.
the iodine is being incorporated into this protein framework.
Exactly. And during this process, the iodine attaches to specific building blocks called tyrosine residues, which are part of the thyroglobulin molecule. This leads to the formation of two important molecules: monoiodotyrosine, or MIT, which has one iodine atom attached, and diiodotyrosine, or DIT, which has two iodine atoms attached.
So MIT and DIT are like the intermediary products, the building blocks that will eventually be used to make the final hormones.
Precisely. It's fascinating how our bodies have these intricate mechanisms for assembling complex molecules.
It really is, and it makes you appreciate the delicate balance that needs to be maintained for everything to work properly. You mentioned earlier that some tissues besides the thyroid can transport iodine. What about those tissues? Do they also iodinate proteins?
That's a great question. While tissues like the salivary glands and the lining of the stomach can actively transport iodine, they lack the crucial enzyme, thyroid peroxidase.
Ah, so they can take in the raw material but can't actually use it to build the hormones.
Exactly. That's what makes the thyroid so unique and essential.
I see. So we have these MIT and DIT molecules attached to the thyroglobulin protein. What happens next?
The next stage is called coupling, and this is where those building blocks, the MIT and DIT, are linked together to form the actual thyroid hormones.
So it's like the assembly line where the final product is put together.
Precisely. And guess who plays a starring role in this process?
Let me guess, our old friend thyroid peroxidase.
You got it. This versatile enzyme facilitates the coupling of MIT and DIT. When two DIT molecules are coupled together, they form T4, which is thyroxine.
And what about T3?
When one MIT molecule is coupled with one DIT molecule, they form T3, triiodothyronine.
I see. So it's all about how these building blocks are combined.
Precisely. And it's important to note that these newly formed T3 and T4 molecules are still attached to the thyroglobulin protein at this stage.
So they're like finished products still on the assembly line, waiting to be packaged and shipped.
Exactly.
Where are these T3 and T4 molecules stored before they're released into the bloodstream?
Well, they remain attached to the thyroglobulin protein and are stored within the colloid, that gel-like substance inside the thyroid follicles.
So the colloid acts like a reservoir for thyroid hormones.
Precisely. It ensures that there's a ready supply of hormones available when the body needs them.
How does the body signal the thyroid to release those stored hormones?
The release of thyroid hormones is primarily regulated by a hormone called thyroid stimulating hormone, or TSH, which is produced by the pituitary gland in the brain.
So it's a hormonal cascade with the pituitary gland telling the thyroid gland what to do.
Exactly. When the body needs more thyroid hormone, the pituitary gland releases more TSH, which travels through the bloodstream to the thyroid gland.
And what does TSH do to the thyroid?
It binds to specific receptors on the thyroid cells, triggering a series of events that lead to the release of stored thyroid hormones.
So it's like a messenger telling the thyroid factory to start shipping out the product.
Exactly. And this release process is also quite fascinating. The thyroid cells essentially engulf portions of the colloid containing the thyroglobulin with its attached T3 and T4 molecules. This process is called endocytosis.
So it's like the factory workers packing the finished products into shipping containers.
Precisely. These containers, called vesicles, then fuse with other compartments inside the cell called lysosomes.
Lysosomes, what are those?
Lysosomes are like the recycling centers of the cell. They contain powerful enzymes that can break down large molecules.
So they're going to break down the thyroglobulin and release the T3 and T4.
Exactly. The lysosomal enzymes, called proteases, essentially cut the thyroglobulin molecule, freeing the T3 and T4 hormones.
And then those free hormones can finally enter the bloodstream.
Precisely. They diffuse out of the thyroid cells and into the capillaries, where they can be transported throughout the body to exert their wide-ranging effects.
It's an incredible process, so much happening at the microscopic level.
It really is. And there's one more important thing to mention about this release process.
What's that?
Remember those MIT and DIT molecules that weren't coupled to form T3 or T4?
Right, the leftover building blocks.
Well, the thyroid is very efficient. It doesn't just discard those molecules. Instead, they're deiodinated, meaning the iodine atoms are removed.
So it's like recycling the unused materials.
Exactly. The iodine is then reused to make more thyroid hormones. This conservation mechanism is crucial for maintaining an adequate supply of iodine for thyroid hormone synthesis.
That's amazing. It's like a closed-loop system. Okay, so T4 is the main hormone released by the thyroid. But you mentioned earlier that T3 is actually the more active form. How does that work?
That's a great question. It's important to understand that while T4 is more abundant in the bloodstream, it acts primarily as a precursor or a prohormone.
A pro-hormone.
Yes, it means that it needs to be converted into a different, more active form before it can exert its full effects.
And the more active form is T3.
Exactly. A significant portion of the T4 circulating in the bloodstream is converted into T3 in various tissues throughout the body, primarily in the liver and kidneys.
So it's like a second stage of processing that happens outside the thyroid gland.
Precisely. And this conversion process is facilitated by a family of enzymes called deiodinases. Specifically, an enzyme called type 1,5-deiodinase plays a major role in converting T4 to T3.
By removing one iodine atom, right?
Exactly. It removes one iodine atom from the outer ring of the T4 molecule, transforming it into T3.
So it's like fine-tuning the hormone's activity.
Precisely. And this peripheral conversion allows for greater control over the levels of active T3 in different tissues.
Fascinating. So we have the thyroid gland producing T4, which is then converted into the more potent T3 and other tissues. What regulates this whole process?
Well, as we mentioned earlier, the pituitary gland plays a major role through the release of TSH. But TSH doesn't just stimulate the thyroid to produce and release hormones, it also influences the activity of those deiodinase enzymes involved in peripheral conversion.
So it's like a master conductor, orchestrating the entire thyroid hormone system.
Precisely.
This complex interplay between the thyroid gland, the pituitary gland, and peripheral tissues is incredible. It's amazing how our bodies are able to maintain such intricate balances.
It truly is a testament to the remarkable capabilities of our endocrine system.
Now, we've talked a lot about how thyroid hormones are made and regulated. But before we move on to what can go wrong with the thyroid, I'd like to touch on something you mentioned earlier about substances that can interfere with thyroid function.
Right. There are various substances that can disrupt thyroid hormone production.
Can you give us some examples?
Absolutely. Certain elements like bromine, fluorine, and lithium can block the very first step, which is the uptake of iodide into the thyroid gland.
So they essentially starve the thyroid of its raw material.
Exactly. And then there are medications like thionamides and sulfonamides that can interfere with the organification and coupling processes.
Meaning they disrupt the incorporation of iodine into the thyroglobulin protein and the formation of T3 and T4.
Precisely. It's important to be aware of these potential interactions, especially if you're taking any medications.
Absolutely. It highlights the importance of open communication between patients and their healthcare providers.
I agree.
So we've covered the basics of thyroid hormone synthesis and regulation, and we've touched on some substances that can interfere with these processes. Now let's delve into what happens when things go wrong with the thyroid.
That's a crucial area to understand, as thyroid disorders can manifest in a variety of ways.
Right. And one of the most common problems is hyperthyroidism, which occurs when the thyroid gland produces too much hormone.
Exactly. And this overproduction can lead to a cascade of symptoms throughout the body, affecting virtually every system.
What are some of the most common symptoms of hyperthyroidism?
Well, they can vary from person to person, but some classic signs include unintentional weight loss, even with an increased appetite, rapid heartbeat, anxiety, nervousness, tremors, heat intolerance, and difficulty sleeping.
Those sound pretty debilitating.
They can be, especially if left untreated.
What about physical signs? Are there any visible changes that might suggest hyperthyroidism?
Yes, there are. Some people might experience bulging eyes, known as exophthalmos, thinning hair, moist skin, and an enlarged thyroid gland, which might be visible as a swelling in the neck.
So there are both internal and external signs to watch out for.
Precisely.
What causes the thyroid to become overactive in the first place?
There are several potential causes. One common cause is Graves' disease, an autoimmune disorder where the body's immune system mistakenly attacks the thyroid gland.
So it's like the immune system turning against its own body.
Exactly. In Graves' disease, the immune system produces antibodies that mimic the action of TSH, that hormone from the pituitary gland that normally stimulates the thyroid.
So these antibodies constantly tell the thyroid to produce more hormones, even when it's not needed.
Precisely. And this constant stimulation leads to an overproduction of thyroid hormone.
Are there other causes besides Graves' disease?
Yes, there are. Another possibility is toxic multinodular goiter, where the thyroid gland develops multiple nodules that function autonomously, meaning they produce hormones regardless of TSH stimulation.
So they're like rogue factories operating outside the normal control mechanisms.
Exactly. And these nodules can produce excessive amounts of thyroid hormones, leading to hyperthyroidism.
Are there any other causes we should be aware of?
Yes, inflammation of the thyroid gland, known as thyroiditis, can also cause a temporary overproduction of thyroid hormones.
How does that happen?
Well, the inflammation can damage thyroid cells, leading to a release of stored hormones into the bloodstream.
So it's like the factory accidentally spilling its inventory.
Precisely, and this can cause a temporary surge in thyroid hormone levels, leading to symptoms of hyperthyroidism.
I see. So we have Graves' disease, toxic multinodular goiter, and thyroiditis as potential causes of hyperthyroidism. How is this condition diagnosed?
The diagnosis typically involves blood tests to measure thyroid hormone levels. In hyperthyroidism, we'd expect to see elevated levels of T3 and T4 and a suppressed level of TSH.
Why would TSH be suppressed?
Well, the pituitary gland, which produces TSH, is very sensitive to thyroid hormone levels. When those levels are high, the pituitary reduces its production of TSH in an attempt to lower thyroid hormone production.
So it's like a feedback loop where the pituitary tries to rein in the overactive thyroid.
Exactly.
Are there any other tests that might be done to diagnose hyperthyroidism?
Yes, there are. A radioactive iodine uptake test can measure how much iodine the thyroid gland is absorbing. In hyperthyroidism, the uptake is often increased.
I see. So it's a way to assess how active the thyroid gland is.
Precisely. And in some cases, a doctor might order a thyroid ultrasound or a biopsy to get more information about the structure of the thyroid gland.
So a multi-pronged approach is often used to diagnose hyperthyroidism.
Exactly.
Now let's talk about treatment. What are the options for managing hyperthyroidism?
There are three main treatment approaches: medications, radioactive iodine therapy, and surgery.
Okay, let's break down each of those options. Starting with medications, how do they work?
Antithyroid medications work by blocking the thyroid gland's ability to produce hormones.
So they essentially shut down the hormone factory.
Precisely. The most common medications used are methimazole and propylthiouracil.
What about radioactive iodine therapy? How does that work?
Radioactive iodine is taken orally, and the thyroid gland absorbs it, just like regular iodine.
But this type of iodine is radioactive.
Yes, it emits radiation that damages the thyroid cells, reducing hormone production.
I see. So it's a way to shrink the thyroid and reduce its activity.
Exactly. And what about surgery?
Yes. When would surgery be considered?
Surgery, which involves removing all or part of the thyroid gland, is typically reserved for cases where other treatments haven't been successful or aren't suitable.
What are some reasons why surgery might not be the first choice?
Well, it's a more invasive procedure than medications or radioactive iodine, and it carries risks, such as damage to the vocal cords or the parathyroid glands, which are tiny glands located near the thyroid that regulate calcium levels.
So it's a decision that needs to be carefully weighed with the patient's individual circumstances.
Absolutely.
This has been a really insightful discussion on hyperthyroidism. Now let's shift our focus to the other end of the spectrum, hypothyroidism, where the thyroid gland doesn't produce enough hormone.
Right. Hypothyroidism can be just as problematic as hyperthyroidism, albeit in different ways.
What are some of the most common symptoms of hypothyroidism?
They can be quite varied, but often include fatigue, weight gain, feeling cold, constipation, dry skin, hair loss, depression, and difficulty concentrating.
So it's like the body's metabolism is running in slow motion.
That's a good way to put it. The lack of thyroid hormone slows down many bodily processes.
What causes hypothyroidism?
The most common cause worldwide is iodine deficiency.
Iodine deficiency. Didn't we talk about iodine being essential for thyroid hormone production?
Exactly. Without enough iodine, the thyroid can't make enough hormones.
I see. Are there other causes besides iodine deficiency?
Yes, in countries where iodine intake is sufficient, the most common cause is Hashimoto's thyroiditis, an autoimmune disorder where the body's immune system attacks the thyroid gland.
So similar to Graves' disease, but in this case, the immune system is destroying the thyroid instead of stimulating it.
Precisely, and this destruction leads to a decrease in hormone production.
Are there any other potential causes of hypothyroidism?
Yes, there are. Previous treatment for hyperthyroidism, either with radioactive iodine or surgery, can sometimes lead to hypothyroidism.
That makes sense. If you destroy too much thyroid tissue, you can end up with an underactive thyroid.
Exactly. And certain medications, radiation therapy to the neck, and even some congenital conditions can also cause hypothyroidism.
So a wide range of factors can lead to an underactive thyroid. How is hypothyroidism diagnosed?
Similar to hyperthyroidism, the diagnosis is typically made through blood tests. In hypothyroidism, we'd expect to see a low level of T4 and an elevated level of TSH.
Why would TSH be elevated in this case?
Remember, the pituitary gland is constantly monitoring thyroid hormone levels. When those levels are low, the pituitary increases its production of TSH, trying to stimulate the thyroid to make more hormones.
So it's like the pituitary sending out a distress signal trying to get the thyroid to work harder.
Exactly. But in hypothyroidism, the thyroid is unable to respond adequately to that stimulation.
How is hypothyroidism treated?
The primary treatment for hypothyroidism is hormone replacement therapy.
So essentially giving the body the thyroid hormone it's missing.
Precisely. The most common medication used is levothyroxine, a synthetic form of T4.
And that helps to restore normal thyroid hormone levels.
Exactly. It's usually a lifelong treatment as the thyroid gland is unable to recover its function in most cases.
I see. So regular monitoring and adjustments to the medication dosage are important.
Absolutely. It's important to find the optimal dose to alleviate symptoms and maintain normal thyroid hormone levels.
This has been a very comprehensive overview of hypothyroidism. We've covered the causes, symptoms, diagnosis, and treatment. Now, before we wrap up our deep dives into the world of the thyroid gland, I want to touch on one more interesting topic.
Sure. What's that?
We've talked about substances that can interfere with thyroid function. Are there any foods or substances that can specifically disrupt hormone production?
Yes, there are. Certain substances, known as goitrogens, can interfere with the thyroid's ability to utilize iodine, which, as we've discussed, is crucial for hormone synthesis.
Goitrogens. Interesting name.
Yes, the name comes from the fact that these substances can contribute to the development of goiter, which is an enlarged thyroid gland.
I see. So how do goitrogens work?
They primarily work by blocking the uptake of iodine into the thyroid gland.
So similar to those elements we discussed earlier, like bromine and fluorine.
Exactly. And when the thyroid can't get enough iodine, it can't make enough hormones.
And this leads to the pituitary gland releasing more TSH, trying to stimulate the thyroid.
Precisely. But because iodine uptake is blocked, the thyroid can't respond effectively, and the increased TSH stimulation can lead to the growth of the thyroid gland itself, resulting in a goiter.
That's fascinating. So what are some examples of goitrogens?
Well, they can be found in both foods and medications.
Let's start with foods.
Right.
What are some goitrogenic foods?
The most common culprits are cruciferous vegetables, such as broccoli, cabbage, cauliflower, and Brussels sprouts.
Really? Those are considered healthy foods.
They are, and for most people, moderate consumption of these vegetables is perfectly fine.
But they can be problematic for the thyroid.
They can be if consumed in very large quantities or if someone already has an iodine deficiency.
I see. So moderation is key. What about goitrogenic medications?
Certain medications, such as lithium, amiodarone, and some antithyroid drugs, can have goitrogenic effects.
So it's important to be aware of these potential interactions.
Absolutely. It's always a good idea to discuss your diet and any medications you're taking with your healthcare provider, especially if you have any concerns about your thyroid health.
This has been an incredibly insightful deep dive into the world of the thyroid gland. We've covered so much ground, from its intricate structure and hormone production to the various disorders that can arise and the substances that can influence its function.
It's been a pleasure discussing this fascinating topic with you.
Likewise, I think our listeners now have a much greater appreciation for this small but mighty gland and its profound impact on our overall health and well-being.
I agree. It's a reminder that even the seemingly smallest parts of our bodies can play crucial roles in our well-being.
Absolutely. And as we've learned today, maintaining a healthy thyroid requires a delicate balance of factors, from adequate iodine intake to a well-functioning immune system, to being mindful of potential interfering substances.
It's a complex interplay of factors, but understanding those factors empowers us to take better care of our thyroid health.
Exactly. And that's what we're all about here, empowering our listeners with knowledge and insights to help them navigate the complexities of their own health.
Well said.
Well, I think we've covered everything we set out to discuss today. It's been a fascinating journey.
I agree, and I hope our listeners have enjoyed it as much as we have.
I'm sure they have. And for those who are eager to learn even more about the thyroid and other fascinating aspects of human health, be sure to check out the London Heartbeats Z Academy UK.
They offer a wealth of knowledge and resources.
Absolutely. And don't forget to subscribe to our social media channels on Facebook, Instagram, and YouTube for free, regular updates, and to stay tuned for our future deep dives.
We're always exploring new and exciting topics.
Exactly. So, until next time, keep those brains curious and those bodies healthy.
And remember, knowledge is power when it comes to your health.
Well said.
Thank you.